professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this video, I'm going to be going over a map that I created and compared to some policy considerations that is differential among the states. This is the first of its kind that I'm making due to the fact that this is one where policy is being combined with some social determinant skills of mapping. So usually when I do my descriptions and videos, I provide a description of the map, what is going on in different areas, but for the first time what I'm doing here is comparing it to what is going on at a policy level. I always say that when you have some sort of findings, or when you have a map or anything, the only way to enact that is through policy. So the map on the right is looking at the distribution of health insurance, and so the bluer states are actually places where people don't have health insurance. So looking at, let me back up a little bit. So this is the distribution of people without health insurance on the right. But let me back up a little bit, talking about health insurance. After Obamacare and the Medicaid expansion program, a lot more people in general were covered for health insurance. However, what happened, and I'm going to talk about the story of Texas in just a bit, but what happened was that a number of states decided that they were not going to participate in Medicaid expansion programs. And this is one of those programs. It's been around for a long time, and it really helps vulnerable populations. And so when you don't have this as a safety net within society, that really puts pressure on our vulnerable populations, and so not only does that have an effect on health outcomes, but the health expenditures actually in the long run increase when you don't have this sort of spending. So these 12 states are the ones to mainly keep an eye on. But given this, I want to go over a caveat here. So one thing that you might be interested in looking within the context of a map is those states where there was Medicaid expansion. Why is there lower rates of health insurance percentage? One state that I would point out here is certain areas of California. Why are there light blue pockets? It might be worth looking into these specific areas and seeing what the characteristics are. Maybe there's urban areas. Maybe there's migrant workers, and a lot of undocumented workers may not have health insurance. So that might be another reason. So it's good to not only just to take a look at patterns, but anomalies as well. If you expect something to be light blue, like California, if you expect something not to be light blue, so California should be darker, kind of a dark color, because most people it participates in Medicaid expansion. Another place to look at. So, by the way, this map on the left and the orange states are ones that did not participate in Medicaid expansion. This Kaiser Family Foundation map not only goes through the policies in that map, but if you scroll down, you can actually find the individual policies for each map or each state, and then provision of what the specific policies are. So then what you can do on the right is take a look at, think about now how this fits into the broader framework of social determinants of health. Thinking about the 5 domains of social determinants of health, can you think of the one that fits here the best? So if you thought to yourself, healthcare access and quality, if you thought that that was the domain that health insurance and the distribution of health insurance would fall under, then you guessed right. And it's logical. It makes sense because if you have um, a lack of health insurance, then you're less likely to participate in those preventative measures which protects your health. For instance, you may be less likely to get a flu vaccine because you don't have health insurance, and it's not easy to go through times in your life when you don't have health insurance because some of these areas are neglected. So this is something that through a map you can really shed some light on. And so I encourage you to look into a lot of states. I told you at the beginning I was going to come back to Texas, and I want to talk specifically about this state because looking specifically at this state, this is one of the highest rates of low health insurance within the whole country. And things haven't changed in 20 years, at least, if not more. So, the number of people that were that had not had health insurance then hasn't changed much from then to now. So in 20 years, not much has changed, and something's not right about that. If uh, there has been people not covered for that long, then that starts to really affect health outcomes within the state. And I can show you. I can show you how certain, for instance, life expectancy and other areas start to be affected. So society needs safety nets to be able to handle the most vulnerable populations. And this is a concrete way that you can bring together health policy, public health, and medicine, and uh, enact some of these things to make a change in society, write to your state legislators to let them know about this. So I'm going to switch gears here and now kind of expand on this map that I made and add some interesting, add one interesting feature to this because I talked about it, I just talked about it. So I want to actually demonstrate this through a live demonstration. So in one of my demonstrations, I have shown how to, actually a number of them, how to start from a basic map and put one single layer on display. In this part of the demonstration, what I'll do is match this up to life expectancy. And this is the only way to do this to show you a step-by-step process. And so um, here is another feature layer that you can add um, in conjunction with. So this is a neat little way that you can actually take two variables and see the relationship in real time geospatially. So at first, you're gonna have a bunch of bubbles, and it looks a bit distorted, but we can fix that. So here you have provided the two chosen attributes. Now you pick a style. So the one that is highlighted right now is the one that is checked, which is color and size. What you can do is, so there's compare A to B. Do you think that might be a better choice? Let's see. If not, we can change. So yeah, this is interesting, and seems to do one type of kind of one type of analysis, and this is actually providing a ratio. So this is not necessarily the relationship that we want. Um, so this is a better relationship. It's under the predominant category and size, and you can actually look at the information, and it uses hybrid colors, and that is what we want to view the relationship between two numeric attributes. So let's select this, and you can learn more. And this is the hybrid relationship. This is where you can see not only the fact that people don't have health insurance, but right there you can see what's the health outcome. Does it affect life expectancy? So I specifically pointed out Texas. So let's look. I mean, when we looked at the health insurance, if you remember that map, there was light blue all over the state, but seems like certain areas, the light blue corresponds more definitively and significantly to poorer life expectancies. And those are especially areas, I mean, you can target the whole state. Medicaid expansion didn't apply to the whole state, but the places that it is really making leading to poor outcomes within the community, those are the specific areas that you want to create interventions for. And when you're creating interventions, Healthy People 2030 has a plethora of interventions. Additionally, you have resources from the Centers for Disease Control and some other places. So um, these are all facets that you have to keep in mind when you're thinking about healthcare access and quality. One of the major domains of the five domains of the social determinants of health framework. Thank you for listening. In light of recent events, I wanted to record this addendum to this video to actually, one, try to reflect a current event, but two, also go into an aspect of this map that I didn't quite get to in the main segment of my video. So here, let me pull up the legend here, and let's again focus on Texas. So in light of the unfortunate recent mass shooting in Uvalde County, I wanted to specifically take a look, and I'm clicking for to search for the county. But in particularly, I want to see, and here's the life expectancy. Um, I wanted to see the health insurance versus life expectancy comparison. And so, if you take a look, the color is it's not the light green where both are high, but it's actually in a shade where um, life expectancy is uh, there. It's not quite that high, but then percentage of people without health insurance, um, that's pretty high. So the findings here are that the percent health insurance is affecting life expectancy in Uvalde County. And also, I wanted to illustrate what each of the colors represent. So the color that you're looking for with the most deficiencies, so to speak, is places with lower life expectancy and higher rates of health insurance. So when you're seeing the two of those, that's the area that you want to focus on when you're doing your research. So the colors are so let's take a look here. The colors are blue and green. So the life expectancy is more green. So when you have low life expectancy and high percentage, so this blue right here is what are areas of interest. So when you look in Texas, this blue is where you want to then target your community interventions into. So I hope this part sheds a little bit more light on how to interpret access related social determinants of health. Thank you for listening.